Hello, my name is Brandon Ramacco, and today we're going to cover a stretch to help with achy low back pain. Now, this isn't a solution for everything. This is for temporary relief of an overworked and fatigued low back. The long-term solution is proper lower back reconditioning, neuromuscular re-education, basically reteaching the brain how to control the back and use all the muscles of the back. Typically, after an injury, maybe an injury in someone's 20s and they have low back pain and tightness in their 30s, 40s. Um, Typically, it's because the splinting muscles of the back have been activated and have stayed on for way too long. And the splinting muscles tend to be the muscles, large muscles along the spine, and in particular, the quadratus lumborum muscle, sometimes just called the QL. The QL attaches from the pelvis to the ribs. So it goes right about here on both sides. And that's the muscle we're going to start with. Now, the strategy today is a pin and stretch. And this is a two-person job because you can't do this to yourself. So the idea here is we're going to pin the muscle down and then have the other person or the patient move to stretch that muscle. So where is the QL? So the QL goes from about here to here, and again goes lower ribs to pelvic bone. So this is where we're targeting. Now if we go from the obliques, it should feel squishy, 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 and you'll feel a tight band. And in fact, if you push there, with someone with back pain, they'll say, ow, and they'll say, that's my pain. Why are you giving me more pain? But that means you're in the right spot. So then I typically take a reinforced finger, reinforced thumb, so not just my thumb, I might apply pressure with my fingers as well, and they'll have them move to stretch it. And they'll feel pain. It'll be an achy stretching sensation. So I get a good amount of tension here, and they'll have them move to stretch. Since this is in this corner, I'll have them move to the opposite corner. So it's sort of forward and sideways, just like that. So even more forward a little bit. And yeah, just like that. So let's try that. I apply pressure and then have them move. And go. Yeah, just like that. Now, if you wanted to do the muscles along the spine, those muscles tend to be even tighter. I find my thumb just isn't strong enough. I sometimes go to something like this, and I'm really putting my whole body weight into it. These muscles are strong. They'll push you away. They'll snap your fingers off. Well, not literally, but it feels like that. So you might need something to help you push into those muscles if you are going to work along the spine as well. For along the spine, instead of sort of this diagonal and forwards, it is more of a direct straightforward to stretch those. And that is how to do a pin and stretch of the QL and the muscles along the spine for temporary relief of low back muscle tightness and achiness. Cheers.